Okay, everybody, I have on Dr. Jaban Moore here, and I'm really excited to chat with him. I've been following his Instagram account for a while when he had shared some information about kids. You guys know that I have kids and that I'm always trying to find root cause issues going on. I found his account and saw him posting some things, and I reached out and really wanted to bring him on the podcast because he shares a lot of information that we're not told by our pediatricians, we're not told by our doctors to look out for. And I know a lot of you, same with me, has just kind of ran into walls when trying to get answers when it comes to health issues with your kids or with yourself. So I'm so excited to chat with him because he is passionate about people uncovering those root causes of chronic illness and discovering whether they have infections or toxicities or traumas in their bodies. So I'm really excited to have you on the podcast. Thank you so much for taking time to be here.
No, thanks for having me. I found a new love, even more than I had before, about talking about kids. Now that I have an almost 1 year old, so watching him grow and develop has been amazing and a little scary because I know too much for my own good. So there's moments where I'm just like, okay, you're not a doctor, you're just dad.
I'm sure. Well, congratulations. The first year of life it's wild, right? It's like they're just this tiny thing, then all of a sudden they're showing interest in different things and you just see their mind going, and it's such a cool experience. So I'm sure for you, I bet it is hard to be like, wait, do we need to test him for something?
I really try to just enjoy every moment of it. And I've got really great friends that I'm like, hey, you can be his doctor. Of course, I'm still paying attention, but yeah, I love being there in the moments, just seeing all the little things, like him smashing blueberries on his chest when I'm trying to feed him to him.
Yeah, yeah. I know. I love how the iPhones show you like pictures like over the last years or so, and it'll the one popped up of my second the other day with just like avocado smashed all over her face. And I was like, man, it's definitely messy in the moment, but that's how they learn, right? Like they're learning
Mhm.
how to use their hands, how to eat. And it's so fun to see. I wanted to ask you before we dive in, we're going to talk about parasites in kids today, but which I know with you, there's probably 100 different things that we could talk about when it comes to kids, pregnancy, motherhood. So you help people uncover the root causes of chronic illness. Uh, I feel like a lot of people probably have chronic illness, but they're not even recognizing it. So at what point do you feel like people are like, hey, maybe this isn't just a symptom that I have to live with my whole life, or you just get used to it. You're just used to
Mm.
for years for me, before I had worked with a functional doctor 5 years ago, I was just used to being bloated and never and always having loose stools. So I was like, this is just my normal life. I didn't think anything of it until I actually did an interview with somebody and he offered to do some testing. And I was like, oh, snap. I have a lot going on that I had no idea was there.
Mm. You know, the average population probably thinks chronic illness is normal at this point. 60% of the United States is diagnosed with some sort of chronic illness. Now, I'm going to say some things. People are like, that's not a chronic illness, but it is. High blood pressure, high cholesterol, diabetes, blood sugar issues, right? All of these are illnesses. They're chronic symptoms. Uh, Low back pain, anxiety, depression, IBS. I once asked a young woman in my office, um, just to be honest, I mean, like men, we just don't talk to each other about how we poop. Like we just don't do that.
Yeah.
So I'll ask women a little more often. They're way more connected. And oftentimes it's like when I see men in my office, I'm talking to their wives or their wives are like, whoa, 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 hold on. He forgot to say something there. Um, so owners more trustworthy in the health spectrum. So I asked this young woman, like, how many out of 10 of your friends have some sort of digestive issue? And I said, that means constipation, diarrhea, bloating, acid reflux. I mean, realistically, do you know your stomach exists outside of when you're eating or when you're hungry? If you do, there's probably something going on that is a symptom that's not normal. When I tell people this, when I say, I don't feel my organs. I don't feel my stomach. I don't know that they're doing their job because they're just doing their job. That's the goal. It's not to be oblivious, but it's for things to work normally. So if you hurt, if you wake up and you're just like, I cannot get out of bed, if you walk into rooms often, like when sometimes when women are pregnant, and you forget why you're doing that, it's not normal, and stop accepting it and start doing something about it. Now, the typical person doesn't come into me until like they can't function, right? So they're coming into me when the floor is fully fallen out from under them and they no longer are able to do the things that they love. They can't play with their kids the way they want to. They can't remember people's names to the point that they're getting asked, "Are you okay?"
Mm-hmm.
They hurt so bad that they're letting their significant other do different tasks that are fun and not doing fun things on their own because they hurt. So that's when people actually make a change, is when really when their why for life is taken from them.
Mm-hmm. Yeah. And I'm sure so many of them have too probably like hit walls in the medical system, in our Western medical system. I've had so many friends be there. I had a friend a few years ago who developed this like nodule like on her throat, and she went to so many different doctors, and one doctor said it was her thyroid and that it needed to be removed. And she refused to accept it, and
Whoa.
she went somewhere else, and the person actually was like, "Oh, it's a cyst. I'll drain it for you right now." And she was like, "This other doctor was about to take my thyroid out." Like, that's insane. So it sucks that we live in a place where we have to like advocate so hard. And that you can't necessarily just trust answers given to you, or just blindly start taking a medication without being like going on thyroid medication is a huge thing. You're going to be on it for life. Like, it depletes your natural thyroid. So like, maybe getting second opinions or turning somewhere else, but you have to really educate yourself and advocate. And I'm sure like it's once you aren't getting enough of the answers that you want that they're like, "Hey, we're here now. Like, can you please help me?" Because nothing else has. Um, so I know so many people listening, I'm sure, could resonate with that. And I'd love to have you on again to talk about pregnancy stuff. Because when you walk in a room and you're like, "Why am I here?" That's where I'm at in life right now. But it's definitely a crazy season. I woke up with 3 kids in my bed, and I'm still nursing 2 of them, so I'm like
Hmm.
losing my mind. So legit losing my mind. But it's a lot. But there's also a lot of things you had used the word like where these things aren't normal. Like, so many things are considered normal, but they're not. They're just common. It's like
Hmm.
it's common for a lot of women to have digestive issues and have, other hormonal stuff, but it doesn't mean that it's normal. And I think we've gotten so far away from what normal actually is that we don't even know what it is anymore. Like, I could probably say I'm not sure what like my normal state of being would be, like what normal energy
Hmm.
levels for myself would be, because I haven't been at that place for a very long time.
That's the problem that we run into is, well, one, our medical system is designed around acute care management. So you were talking about like, let me remove the thyroid for that person that you were giving an example of. Every individual has a skill set, right? Like we all have a job to do and we all have knowledge that we have trained in and learned, and doctors are no different. And doctors, depending upon the degree you have, you may be an MD that's a surgeon, like a cardiac surgeon. Okay, you're going to know the heart's anatomy in and out, but you may not know very much about the foot, right? You also probably don't know squat about herbs. You may know very little about actual nutrition, most likely, unless you've done extra research, just because I'm talking about like the actual training. A chiropractor, that's where my degree came from originally. And then I've done so much more training since then. Like we got taught basic medication, basic toxicity, basic labs. Of course, we knew the anatomy of the spine and the bone structure in and out. We knew physiology pretty well, but we didn't get trained a lot in nutrition. Like that's postdoctoral training for me. So our medical system lifts up doctors as knowing so much information. And unless that person has a passion in that area and a lot of effort to keep up with the times, you're outdated each year. So When people go to their doctors and their doctors tell them, well, here's a thyroid medication, go for it. That was like 1970. Now, if you actually get to the literature and you look at it, 80% of people with hypothyroidism have an Hashimoto's autoimmunity. So therefore, that medication may make them feel better temporarily, but it's not going to make them better long term. It's going to create maybe more issues, and it's going to have them going up and down through swings. So why don't we run the complete lab panel for the thyroid along with everything else that would come into that? Because there's way more to it than that. Um, but at least run a complete thyroid panel to understand, is there an autoimmune component? Because 80% of the time there is. And now we can have a different plan of action, which, by the way, isn't going to be likely to be Western medicine, because Western medicine right now, when they see autoimmunity, they have choices: deal with it or put you on a medication that suppresses your immune system. Whereas, again, the literature and the studies, like case studies for clientele, I had a client that was Hashimoto's. She came with 7,000 antibodies. That's an incredible amount. And after doing a Lyme protocol, her treating physician called her and said, "What did you do? Your new antibody load is 2,000." And it was only like 3 months later. She ran every 3 months because this guy was good. He kept up with things. He was looking for answers. And then we did a parasite protocol and it dropped to 500. And then we kept going until we got to a point where she was well. But um, yeah, looking for answers is a everyday thing, because I don't want to be somebody's next provider. I want to be the last one for the issue that we're dealing with. And I'm not saying I can deal with every issue, but if I take somebody on, my goal is to help deal with that situation to where we can overcome it and move on and get back to, like I mentioned earlier, our why for life. Like right now, my why for life is, like, literally I have this screen up and we're talking, and behind it is toys for my son's first birthday. So like he's the why now. And I'm gonna do everything it takes for me and for him to stay well so we can enjoy it. Because the joy that that brings me, I can't even imagine that being taken away from me, from going back to the days when I had Lyme disease and I was sick.
Yeah. hmm Yeah, I love that. Um, and it's, yeah, I know so many people who have dealt with like a lot of this stuff. I know somebody who has an autoimmune issue who's going through a Lyme protocol right now. So I had
Mhm.
never heard of that until she told me, which is super, super interesting. So let's talk about kids, because obviously as adults, like we have such a hard time figuring out what's going in our own bodies. So I'm sure kids have a really hard time understanding what's going on theirs, and even like communicating their needs, and what's happening. So you had done a post about parasites in kids, and my only experience with that was, I know somebody whose 5-year-old had gotten to a point where she was like falling off of the growth scale, and they had tried a bunch of things and were like worried about her. She was so tiny, found out she had a parasite. And after treating that and doing some like food sensitivity stuff and some gut healing protocols, she started getting back on. When I worked with a functional medicine doctor 5 years ago, I found out I had a parasite. Zero idea. And I'm like, I didn't know that it was like a common thing. I was like, oh my gosh. And he's like, actually, this is a pretty common parasite. And I was like, what? Like, I had no idea. And I wouldn't have really been able to let my gut do some of the healing it needed to, which was impacting my hormones, which was impacting, everything. Had I not worked on getting rid of the parasite. So I'd love to just kind of you share some information about with our kids, maybe start with signs or symptoms, or I don't know, I'll let you take it away.
So we'll do a little parasite 101 here, just blow some minds. So parasites, the things that if you talk to most docs around the United States that are conventionally trained are going to say, we don't deal with that. We're in the US. We're a westernized country. 3.5 billion people on the planet, the World Health Organization says, is going to deal with parasites. There's what, nearing 8 billion people, so like most of us.
Yeah.
In the United States, a westernized country, we had 1 million, so one out of every 330 people, 1 million cases of Giardia diagnosed, which means that they got the parasite, they had loose stool, digestive irritation. They went in, they got it tested, it was positive, and then they treated it. You can, in your own body, sometimes harmonize Giardia enough to where it's not any longer pathogenic to the point where you're like, I have to go to the hospital. Some people have diarrhea for a few days, they'll call it food poisoning, and then it just doesn't set right for a while. That can still be Giardia. So we
What
had a
is, sorry,
million
can you
known
explain what that
cases.
is? Giardia?
Giardia is a parasite.
Okay. It's
It's a
just,
specific parasite you get from like the lake, swimming around the lake, being
okay.
outside, being around water.
Mm-hmm.
So that's another common parasite. 100 million people are dealing with strongyloides in the world, which is another parasite. So they're really pretty common, right? Like that's huge numbers. And so the concept that we don't deal with them is crazy. Not to mention, I mean, do you have a cat, dog, horse, ferret, cow? I mean, whatever animal you have, when you take it to the vet, they're like, hey, you should probably deworm your animal once to twice a year minimum. Why? It lives in the same exact environment you do. It touches the same dirt, same carpet, same couch, same floor that you do. And I'll almost guarantee that their food likely is less likely to have a parasite than yours is. Because why?
Highly
It's
processed.
like little granule things that's tested to make sure it's perfect, that doesn't have the possibility of being raw or from dirt or the ground. Whereas I don't know about you, but I'm guessing that majority of the people that are listening to you care about their health or their children's health. So they're probably trying to eat as good as they can, or they're shifting in that direction. So they might be like a whole food organic type person. So they're eating vegetables and apples and they're eating meats. I'm not saying raw meat. You can cook your meat, still can have parasites in it. So remember, your animal's eating these little pellets that are tested for parasites. Your steak, your raw vegetables at the farmer's market are not. And I'm not trying to scare you. I'm just saying we come into contact with parasites all the time. A healthy person with a healthy body with appropriate digestive juices and hydrochloric acid are going to defend it. So if you have all those things, your body has bacteria and enzymes and acid that will defend you from parasites, and you'll be good to go. So for kids, when they get parasites, they grind their teeth, they wet the bed, they get more irritable. They'll oftentimes start having yeast issues. So they'll get those little white bumps popping up on their skin, which then maybe we'll get lucky and we'll get a antifungal, which is not an antiparasitic. It'll take care of the fungus, but usually parasites are never even considered. They'll start getting eczema rashes. These are common. They could have digestive bloating or stool issues. They could also have stomach pain. I can't tell you how many kids have come to my clinic and they came straight from the children's hospital where I'm at, and they were diagnosed with functional abdominal pain. And the first time I heard that, I go, what is that? That
Yeah.
doesn't even sound like a diagnosis, first of all. Nope, got the medical records, functional abdominal pain. Person still functional, has abdominal pain. Hey, what do we do about this? No answer. So what am I doing? I'm running labs and doing tests and okay, we do a parasite cleanse. You know what? That abdominal pain isn't functional anymore. It's gone.
Mm-hmm.
And I mean, I just joked about it. I'm like, come on, like IBS is, I don't know what's wrong, but you have stomach pain, right? So that's literally what the definition of it is. It's idiopathic bowel problem, meaning we don't know what it is. Same thing could be fibromyalgia. You're hurt and you don't know why. Chronic fatigue. You're tired and you don't know why. Um, so figuring out a reasoning is very important. But for kids, they can't communicate the same way an adult does. If they're itching their butt a lot, they might have a parasite. So all of these things are common, and they transfer to adults too. Adults can have the same stuff. They can have the same symptoms, but kids just can't communicate it as well because they don't know how to articulate, "Mommy, my tummy hurts," as
Mm-hmm.
well sometimes. Like my little guy, he can't talk well yet, so he's not going to tell me that. He's just going to be mad, which is going to make me mad because I'm not going to get sleep.
Mm-hmm.
So I'm always checking him out and poking him and doing little things, not poking too hard, but just making sure that he's doing all right. So we've talked about how common they are. We've talked about they can come from your food. They can also come from lakes, dirt, animals. So if you have an animal, like it's scooting its butt across your bed, or it's licking its butt and
Yep.
licking your face,
Yeah.
you can get parasites. But again, I don't want to create fear. Like that's not my purpose. I love people that have animals. And all the little fur babies. I love going outside and spending time in lakes and outside. I don't want you to be afraid of it. What I want you to do is take from this, yes, they're there. Just like you have bacteria in your body, you have viruses in your body, and it's all about optimizing the physiology, optimizing your body, your nervous system, your immune system, so that it can do its job, which is protect you, and crowd control. That's the way that I talk about the immune system. It's crowd control for all the little bugs inside you, because there's billions of bugs inside you. So we got to have good crowd control. Um, so yeah, I'll let you take it from there because I'm sure you have other parts you want to know about.
Yeah. Well, no, I just feel like I have to get both my girls tested because I'm like, wait a second, they have a couple of symptoms. But I'm definitely somebody who always like, I do push for that. And like lately, I've been in a situation where I've taken my oldest daughter in like a few times and I'm not getting the answers I want. So now I'm looking elsewhere because I've also been like completely gaslit, like at my pediatrician. Um,
Mm.
who's supposed to be more of a holistic one, but when I was like, this thing happened, she's like, I don't know, that's really uncommon in somebody her age. And I'm like, okay, well, I'm telling you what happened. And she's like, are you sure? I don't know. I'm like, yes, I know exactly what happened. You know what I mean? Like, yes, like I'm her mom. I know that this is what it was. And so it just like it can be so extremely frustrating. So then you have to look elsewhere. So for people listening, if they're like, okay, like one thing that I see, so many kids have bumps on their arms. They get like these little
Mhm.
bumps. I've heard that it can be like underlying celiac issues. It could be parasites, like who knows? So it's like, how do we know? It's so common. There's so many of these things that are common that it's like the bloating can be common, the rashes, it's like kids just get eczema randomly. So um it's like, how do you know like when, because it's like every single time your kid's like, my tummy hurts, you're not going to rush to get a parasite test. So like, when do you know how, like when to test them and like, where do we turn to do that?
Yeah, so I'll just go to your skin thing. Um, yes, skin issues, whether it's the little bumps in the back of the arm, eczema, psoriasis, little white-headed bumps, which can be yeast. When you have stuff on your skin, there's differential diagnosis. So what's the possibility? That's where my brain goes. I'm like, okay, so what could cause that? Gluten, dairy, for sure. Parasites, yes. So those are the things that are going to come to my mind. Like, so food allergy, parasite are going to be the top of the list there. If you have a digestive issue, bacteria, yeast, parasite, those are going to be the top ones there. Food allergy is possible. But what is a food allergy? It's a time when your body identifies that you have some sort of thing in your body that it doesn't like that could cause you harm and it needs to be attacked. So is that because it's bad, or is that just because your body's identified it to be bad? Probably because your body identified it to be bad, because a lot of people develop food allergies later in life to things that they were eating all the time that are not bad for them.
Mhm.
So it's the body being overstressed and creating a reaction that leads to a food allergy. So when I'm looking at anybody, working with anybody, I'm thinking through what are the different possibilities of this? Worst case scenario, best case scenario. Is it more than one thing? Like there's all these thoughts that you've got to think about to make sure that you're doing the right action afterward. And realistically, if you can just simply get the body strong enough to be able to adapt, it'll take care of most things. So you don't
Mhm.
have to worry about as much. And then you said, when should you get tested? When should you treat? Well, you go to the dentist twice a year to brush your teeth, whether or not you have a cavity.
Mhm.
I'm kind of the same, like you should just cleanse your body a couple times a year. I try to do it quarterly just because you want to make sure to stay clean. So yes, if you're having those symptoms, go see somebody, get checked out, run some blood work, make sure that you are getting yourself taken care of, your kids taken care of, make sure there's not markers on there that we don't want to see. But then otherwise, just do it quarterly to stay well so that you can be in that health spot. Because today's society, it's not, are we coming into contact with toxins? Are we dealing with traumas? Are we overstimulated? It's we are all of those things. So we have to make choices to stay well. We're not any longer searching for food. We're not looking for clean water. We're not trying to find shelter. We have all of that all the time. So much so that now our issues are shifted to, okay, now we've got to take care of ourselves because our environment is so clean as far as, or so curated, unfortunately, just not in a good way, and now it's toxic. So one thing that people have not heard is parasites. One of their actual synergistic, meaning helpful jobs in the body, is that they're supposed to come in and clean up toxins for you. So they're supposed to come in and soak up metals and environmental toxins because they can carry 6 to 8 times their body weight. So, a couple hundred years ago, you drink from a lake or a spring and it has too much metal in it because whatever reason, your body would actually allow parasites in to soak that up. And then once it's soaked up, your body would then kick the parasite out immune wise and we're balanced. But now it's constant more toxicity. So our body brings these things in and then it doesn't get rid of it because it's got more toxins to soak up. So then they multiply the parasites. Now they become a problem. So there is a reason why they're there. They are there. You do run into them. You probably, if you have a pulse, have one. It's just, is it pathogenic or is it not pathogenic? So I'm not saying everybody's sick from them. I'm just saying that we all have bacteria, viruses, parasites, funguses. And as long as our body can use them as part of the ecosystem, you're well. When the
Hmm.
ecosystem breaks down due to stress, toxins, and trauma, infections, now we have problems. Now we have symptoms.
Hmm. Yeah, that makes sense. That's crazy that like how you described it, like why the body used to let them in. And now it's like, wait a second, our toxin load is really heavy. So um it's crazy, yeah, because I think so many of the things that used to serve us a long time ago are creating more stress now. Just
Mhm.
even people being like flight and fight mode, like it was there for a reason. But now it's just constantly turned on. It's like, well, you're not running from a bear right
Mhm.
now, so you need to like calm down. But we're just kind of like stuck in these things that were originally meant to serve us, but aren't anymore.
Mhm.
Um, yeah, that's super interesting. So what does the test look like? Is it a blood test? Is it a stool test? Saliva? What kind of testing do you do for parasites?
So the standard of care out there is a stool sample. They're not the cheapest things, and they're highly, highly, highly inaccurate, unfortunately. So they're not bad for bacteria, but when it comes to parasites, they're darn near useless. So that's unfortunately kind of where it lays. Now, you can find some parasites like babesiosis, which is a common co-infection of Lyme disease through a IgG test. We don't have that for all the different types of parasites out there. Stool samples is how they did it, but they're looking for ovum. So it has to be during the right part of that parasite's life cycle. You have to catch the right sample. It has to be to the lab quick enough. It can't have other particulates in it that would be parasitic in nature to get identified. It had to be specific to what the tech is trained on. They get 2 to 3 minutes to look and then they move on to the next one. So the testing right now for parasites, because we all believe we don't have it, is pretty much atrocious. There are some new things coming out. There's a person that's a pathologist that actually knows what he's looking for, spends more time, which means it's more expensive. That is gaining ground, and I'm hoping that that will continue and become more mainstream. But yeah, right now there's not great testing. It's mostly symptomatic. So I have a questionnaire that I have people fill out. That is a questionnaire like, do you have enough parasite symptoms for us to do a protocol? If you do that protocol and then you see parasites come out, great. If not, you spend a couple $100, you made sure that you were clean, and you probably saved a lot of money in comparison to running tests. Because I do know one provider, a friend of mine, he really wants to find every parasite. So he runs 5 or so different parasite panels for a few $1,000s. And I'm just like, I just don't feel like that's the way I want to do it. I'd rather just do the protocol for a few $100. And if you see it, you see it. If not, we'll move forward.
So you had talked earlier about kind of doing a cleanse then throughout the year. What does yours kind of look like? But how would you do that with our children? I know even for parents that are kind of doing that root cause protocol, and let's say they discover their kid has some candida overgrowth, so then they're cutting some stuff out of their diet, and they're like, but my kids love goldfish crackers, my kids love this other thing, like, how am I going to get them to do this? So how do you kind of do, now that you have a kid that's going to be eating food, are you planning on doing like a whole family cleanse a couple times a year? Or like, what does it look like for you and what does it look like for kids?
Yeah, so I think the big thing here is depending on the kid, there's different possibilities. So there's homeopathy, which is colorless and tasteless for the most part. I mean, it's in a little bit of alcohol. Or you can do like the little pellets like from Boron Company. So you can find those. I don't find them to be an end all be all. So I will want to use some different herbs at different times. But what I would do is I would just pick, and I have this. So we have a membership group where we go through these cleanses and I dose it for all different age groups, or body sizes, right? Or sensitivity levels. So with kids, depending upon their size, you're gonna do a lot less. Of course, you want to make sure that if your kid has any sort of sensitivities to walnuts and things, you got to be careful a little bit because um, a lot of the antimicrobial herbs are tree nut category. So you got to be a little careful there. Not all of them, but a lot of them. So just being particular with each person that I'm working with, or if you're doing it in the more of a group setting, making sure that, you look through it as the parent. But how we do it is I don't actually use a specific diet. Again, I think everybody should eat mostly whole food, meaning not from a box. So sorry, goldfish, but I don't particularly love that. I know kids are gonna want to gravitate towards things that spike their dopamine response in their brain, so the neurotransmitter, because they have all the sugar, because as soon as you put a goldfish in your mouth, it starts to melt because that's like the carbohydrate breaking down into sugar immediately. So it gets kids to get that dopamine response, just like you just won an award or won a game, or you're excited. But eating that whole food diet and switching kids toward that, they stop being addicted to that response, and then their diet options start to change. But if you're not there, that's okay. I'm not going to require a diet to go through the cleanse. So we use, especially with kids, we use herbal tinctures or homeopathics because they can be liquid drops and you can mix them into juice to cover the flavor. One of my favorite ones is AP. So for little ones, a lot of times it's somewhere between 5 and 10 drops twice a day, which can easily be covered in juice. And then we partner with it some herbs such as milk thistle, which again you can put in the juice or you can put in a smoothie. And we do that for about 10 days, with the middle day being a full moon, because parasites life cycle actually for many of the species is attached to the full moon. So they become the most active around that full moon phase. So we go like 10 days, day 5 being the full moon. So you get some before and some after when the parasites are most vulnerable. And you do it just 10 days, you do it once a quarter. And I'm hoping to usually use somewhere between 3 and 4 supplements, so not too many. So that kids don't fight back too hard, because I know kids don't always love the taste of dirt. I always tell people, I go, if it was good for you, it probably doesn't taste great, especially for a
Mm-hmm.
kid. So, we try to make sure that it's doable, because I get it. You don't want to start a war with your kid just to get him to take a supplement. You want it to be a family bonding experience, not a fight.
Mm-hmm. You said AP tincture. What's that?
It is a multi-herbal cocktail of things that are helpful with parasites.
Okay. So it's like an all-purpose. What does the AP stand for? That was where my mind went.
No, no, the
No.
company, it's Byron White formulas. A is just a common, like every single one of theirs starts with A,
Oh, okay.
and it's dash P, and I assume it meant parasite. Just
Okay.
looking at the herbs, but it's one that's been very successful for me to relieve symptoms.
Okay. Very cool. Yeah, it's nice that you don't have to like completely do a diet overhaul. Because again,
Mhm.
with kids, especially like when they go through different phases of life, like I remember with my oldest, like just priding myself on she wasn't a picky eater. My kids ate everything. And then one day she didn't. And I'm like, wait a second. They just like they hit this phase where like they want they just get more independent and they want to eat more, like they go through just different phases of what they want to eat and what they don't. but I also am in agreement that like I'm also the one who cooks the food and buys it. So like they eat what I buy
Mhm.
and like what I cook. So even this morning, my daughter really, really wanted me to make pancakes, but I was told her it wasn't on the menu today. We were having sausage and eggs and she ate it just fine. Like, did she cry and get upset?
Mhm.
Yes. But I also wasn't going to make pancakes this morning. So, and then she was like, Mom, can you feed me? And I was like, sure, no problem. You can sit on my lap. We'll eat our eggs and sausage together and that's it. So when they get used to like you not telling them like yes all the time, I feel like my kids, they get used to it. So, um, and they're also just used to like what snacks we keep in the house and the foods that we keep. So, um,
Mm.
it makes it a little bit easier. Uh, but it's nice that you don't have to like do a complete diet overhaul. Like if I had to take fruit away from my kids, I feel like it would be so hard because they love fruit. Um, and they've both kind of been rejecting some vegetables lately, but we hide it in smoothies. Well, we don't even hide it. We show them. They help me pack the spinach in and um, they're pretty good about like, okay, you need to take a bite and they take a bite, but they're like, I don't really want to eat the rest of it. So I feel like they'll come back around. They used to eat them like crazy. So I don't know, like people say it's like normal in toddlerhood, for them to go through these phases. But one of their favorite foods is steak, and another one of their favorite foods is salmon. We actually now have to make an
Yes.
entire whole other steak for my two girls because between the two of them, they eat a whole steak and sometimes still like part of mine. So we're like, okay, we have to now officially cook more steak at dinner time. Um, but the parasite thing now, I'm like, great, are there parasites in my steak? And you said like, don't live out of fear. Is there like a way to eliminate some of it? Like when you're buying produce, I know I wash it, but I don't know if I'm washing it right or if it's really getting out. Is it, if I cook it in my meat, at least is that parasite dead? Like, how is there a
Not
way to
always.
do it? No. Oh, no.
There's not a perfect way, but
Yeah.
here's the thing, like you can't avoid bacteria either. They're
Right.
everywhere. They're on your skin, on your face, in your mouth. They're everywhere. Um, yes, cooking your food to well done is going to have a higher likelihood of destroying any sort of uh, parasite that's there. But not everybody wants to eat a well done steak every time or
No.
a fully well done whatever vegetable that you're cooking. Bubbling it, ozone bubbling can help to pull different things off, like the toxins and the spores off of vegetables and so on. Um, it's funny in the United States, we partner salt and sugar with everything, which is no beneficial effect whatsoever as far as the sugar, besides taste good and diabetes. But in other countries, they pair oregano or wasabi or walnut or turmeric or curries, which many of those have antiparasitic properties. So culturally, for generations, people have figured this out and started doing it. But here in the United States, newer culture, um, I guess we just decided that wasn't a good idea for whatever reason, and now it's making us more defenseless versus helping.
Mm-hmm. Right. Super random. Have you watched the show Parks and Recreation?
I haven't.
You haven't? Oh, okay. Um, there's like a company in there called Sweetums, but they even like add sugar into the water and like all this crazy stuff. But it's like I feel like it's just them like making fun of like the US culture like overall and how we've just kind of processed and changed everything. Um,
Ugh.
so yeah, one of my biggest like I've said it on here on the podcast a million times, just how, when you look at ingredients in other cultures, it's not the same as here. And like it's frustrating
Mhm.
that you can't just go to the store and buy something that's not enriched and added with like a bunch of other ingredients that don't need to be there, but someone in Italy can. So it can definitely be frustrating, but okay, so we can't avoid it completely. And so I mean it sounds like at some point in our life, all of us are gonna have a parasite, basically. And you might know it, you might not.
Like I said, you probably everyone listening right now that has a pulse has a parasite.
Yeah.
Is
Okay.
it pathogenic is the question.
Okay.
And if you're symptom free, then it's very likely not pathogenic. It's not a problem. Just like you have E. coli, strep, staph, H. pylori, who knows what else, maybe even Lyme disease in your body. If it's not pathogenic, it's not a problem. It can be in that homeostasis or that equilibrium where it's working synergistically with the rest of your microbiome. So the fear of organisms at some point in the future, we're not going to fear organisms as much as we fear the dysfunction or the dysregulation of our own immune system. So as you can tell, I'm like, don't fear it. Just acknowledge that when you have symptoms, you got to do something. But we're going to be around organisms forever. Without
Mhm.
them, we literally die.
Yeah. Yeah. Very true. Well, before we wrap up, you had mentioned your membership that people can be a part of, so that they can learn how to do kind of these detox protocols. What else do you offer? And where can people find and follow you, connect with you? I know you don't have to be, you work with people like virtually as well,
Mhm.
which was a great thing that came out of COVID, because a lot of people weren't even open to necessarily doing that. They're like, no, I have to like go to a doctor. And now I feel like so many more people are open to working with people virtually. So if you could share all that information, that'd be great.
Yeah, so we offer one-on-one care. We have the membership. We also put information out on Instagram, TikTok, Facebook. We have a newsletter we send out just with educational information. So you can look us up at drjabanmore.com or on any of those social medias with just Dr. Jaban Moore. So we're just constantly trying to get information out because even as a new parent myself, knowing what I know, doing what I do every day, there's been a lot of questions where I'm just like, I wonder if somebody has a better idea than what I'm doing. I wonder if, you know, what some people that are experts in this area of kids, what they're doing. So knowing that I need more information, one of my goals is just to get as much information out there as possible so that people have an opportunity to educate themselves and make their own decisions. So if you want to join our membership or come see one of the providers in my clinic, we're happy to support any and everyone. We are virtual, so yeah, we work with people around the world, and you know, it's interesting. We just opened up a children's hour within our membership, just ask questions about kids because
Mhm.
we see so many, and we're getting some great feedback back about that because I just don't think there's enough people out there defending our children. I mean, what is it? Like, I just did a talk for a lab company on kids, and it's almost 10 million are diagnosed with anxiety. 1 in 6 have a mental health something disorder that's
Mhm.
diagnosed. 1 in 6 children have a mental health issue diagnosed. That's incredible.
Mhm.
And I don't think it's normal. And I don't think we're just better at diagnosing. This is because of the toxins, the infections, the stress in our environment that's leading to this. And our kids are innocent. Like they don't know better. They don't have a choice. So we have to be there to defend them. And somebody has to get out there and just educate so that parents have an opportunity to make that choice.
Mhm. Yeah, that's so true. And it can be like very daunting, like looking at the statistics that have changed, because we all want better for our kids. Like we all, like you said, just we want to protect them. Um and I know that everybody's doing like the best that they know how. And the point is to like continually learn and grow. And that's why I love this platform and this podcast and bringing guests on like yourself so that we can all learn and grow together. And if one person listening's like, man, my kid just isn't the same and hitting a wall, and then they're like, oh, wait, maybe there's something else going on that we haven't checked out.
Mhm.
So that's why I love like having these talks. So I'll include all the links to connect with you in the show notes so people can easily find you. I've been following you for a long time. Um, he posts so much stuff. Obviously, it's not just about kids. It's for the whole family, and it's not just about parasites. It's just all root cause health. I know you've talked on there too. Oh, what was I just looking at? Um, you posted something and I was like, wait, I have some of these symptoms. See, this is the mom brain thing, right? We call it mom brain. And I was like, did I make a note of it? Cause I'm like, I'm going to ask him about this. And then of course, like I didn't. And I'm like, oh, wait. There it goes. There goes my mom brain. You posted something recently where I'm like, wait, I have some of these symptoms. Could this thing be going on in me? And then I'm like, I need to check it out. But of course, now it's gone. But I'll remember it like as soon as we get off the podcast, or I'll go look. But there's a lot of great information on there. So especially if you're feeling stuck, but even if you're not and you just want to learn and grow and know how to keep your family healthy, definitely go and follow him. So thank you so much for coming on the podcast today.
Thanks for having me.